Barbiturates, a project by Íñigo, Lorena and Irene. Barbituric acid is the source of these substances, which are sedatives for the central nervous system. This acid and its derivatives are known as tranquilizers. The ones which are used most commonly are veronal, seconal, and luminal. Since its discovery in the early 20th century, barbiturates usage has evolved in many ways. These drugs, known for their sedative and hypnotic properties, have been widely used as anxiolytics, sleep disorder regulators, anesthetics, hypnotics, or anticonvulsants in cases of epilepsy. However, after detecting their potential for abuse and recreational use, they have been highly regulated, as an overdose of barbiturates could lead to coma or suicide. As a result, they have been virtually replaced by benzodiazepine-based drugs, which are considered to have lesser sedative effects. In the short term, barbiturates operate similarly to other tranquilizers, inducing sedation, drowsiness, memory alteration, and so forth. Nevertheless, the long-term effects become significantly problematic. We can differentiate the effects at the physiological and psychological level. At the physiological level, the following stand out. 1. Reduction of respiratory rate, thereby diminishing oxygen supply to the brain. 2. Impairment of motor coordination, elevating the risk of falls due to impaired balance. 3. Induction of excessive sedation, which can lead to coma or loss of consciousness. 4. Reduction of blood pressure, potentially resulting in cardiorespiratory failure or hypothermia. At the psychological and psychosocial level, prolonged barbiturate use endangers 1. Dependence development, 2. Alteration of consciousness, 3. Impairment of memory affecting both short-term and long-term memory processes, and 4. Drowsiness or coma. Excessive and prolonged use lead to fluctuations in alertness, reduced cognitive performance, heightened irritability, and memory impairment.
Regarding the withdrawal syndrome, when someone is dependent on barbiturates and they try to get off them, they experience withdrawal symptoms, which may be physical and also psychological. Since abstinence may lead to death in some cases, people usually go through a medical detoxification in which the patient's dosage of the drug is gradually reduced. Most of the physical symptoms occur in the first 3 days of the detoxification, and they can be anxiety, insomnia, high body temperature, hallucinations, tremors, changes in the heart rate, behavioral changes, for instance, aggressiveness, seizures, nausea, or psychosis. These symptoms may be more or less long-lasting depending on the person's age, drug dependency duration, drugs use frequency and quantity, etc. However, the second week mostly brings up psychological and emotional problems, and they may last from a few weeks to several months. In case that the withdrawal symptoms remain after the first 15 days, it's called post-acute withdrawal syndrome. And it occurs when the nervous system does the transition from an abnormal structural and functional state to a health state, and the neurotransmitters have been heavily harmed and damaged. Some of its symptoms can be cognitive difficulties, anxiety, depression, sleep disorders, and irritability. Now I will explain how barbiturates act once they are inside our brains, inside our bodies. They join a site in the GABA receptors. It is they take away the place of GABA, which is the principal inhibitory neurotransmitter in the central nervous system, and as a consequence, they boost the action of GABA, making it difficult for the nervous impulses to fire, thus inducing calm. Barbiturates also avoid the flow of sodium ions among neurons and favor the flow of chlorine ions. They obstruct the action potentials of neurons and decrease the sensitivity of the postsynaptic neuronal membrane towards the excitatory neurotransmitters. All of this meaning that barbiturates act as central nervous system depressants, so they produce sedative, anticonvulsant, and hypnotic effects.
This was a significant year as it is believed to be the beginning of group educating individuals about this method. The result of this article and on the study will those who use other medication had the median age of 55 years. The discussion part is that the statistics clearly show that people taking barbiturates were far more likely to commit suicide. The suicides among the drug overdose and the entire population were almost constant by comparison. Such an indictment then amounts to something special that seems to transcend issuance of barbiturates.